Now we have Mrs. Teresa Polk, who will say a few words, and Ms. Polk comes to us from the National Coalition of 100 Black Women and from the Prince William County in Virginia.
Good morning. I would first like to thank Mr. Farrington and also Dr. Artie Shelton for giving us a few minutes to speak on behalf of the National Coalition of 100 Black Women, Prince William County chapter. I am here on behalf of our president, Dr. Alice Howard. We actually are here in DC as well for the Black Women's Agenda today. And so they are at the Hilton, but I came over to speak on her behalf about what we're doing in our chapter. Our chapter was established in November 2012 with 71 dynamic women. And we have been very busy over the past couple of years with several initiatives. One we're very proud of. Last year we did an initiative on triple-negative breast cancer. We received a $78,000 grant through the Potomac Health Foundation, and we provided education and mammography testing for women in Prince William County, Manassas Park. We partnered with 8 churches in the community, and we held educational, educational sessions at each of those churches, and we received overwhelming support from the community. We partnered with Centera Northern Virginia Medical Center, and we had physicians from their center who provided the education for the ladies that came out. Well, as a result of that partnership and the initiative, we were asked, well, what about the men? What are you going to do for us? So as a result, we decided that we wanted to focus on prostate cancer. And this year, we are in the process of working again with partners in the community. We have received a grant, or we will receive a grant for $103,000, again through the Potomac Health Foundation, and that will be all focused on prostate cancer. So we're very excited about that. I would just like to share with you that on Saturday, September 20th, the coalition, along with our church, the church that I belong to, First Mount Zion Baptist Church, which is in Dumfries, Virginia, our men's ministry, and 7 other churches, along with PHEN, who is a new partner with us, presented a prostate cancer summit. Dr. Shelton was our keynote speaker, and he presented a very dynamic and well-received presentation that was attended by over 200 participants. We were very excited about that. He did a wonderful job, and we had a lot of men who, at the end of his session, stood up and testified, gave their testimony, and it was very powerful. And that was the same type of thing that we had when we did the triple-negative breast cancer sessions. We had over 11 churches that participated that day, and we collected 115 statistical data sheets. Some of the barriers and myths that were identified were fear of the unknown, uninsured, trust and respect for doctors, prefer male versus female doctors, a lack of statistical data on Black men and prostate cancer, and a lack of knowledge. So we know that, there are a lot of issues that have to be addressed. What we plan to do as soon as we get the grant, and what we need to do, of course, is submit the data that we collected along with all the other information, and that will be going forward, I believe, in November, December timeframe. And our goal is to have at least 20 to 25 partners for this initiative, which would, of course, include PHEN, Centera Northern Virginia Medical Center, fraternities, other churches, and other men's community organizations. Although we wrote in 10 churches to participate, this initiative is free and will be open to any male in Prince William County. The programs will be held at 8 churches. We will provide a minimum of 2 hours of educational training, and we plan to try to have doctors on site to actually be able to perform the screenings for those men who need the screenings or those who desire to have them. As I said, when we did the triple negative breast cancer initiative, we partnered with Centera, and they have a mammography mobile van, and we were able to get women signed up ahead, and they were able to do on-site mammograms. So we would certainly like to be able to provide the prostate cancer screening exam, the digital exam. I'm not sure if we'll be able to do the blood test, but we're going to work hard to get all those things ready to have them done when we start this initiative. So we are just very excited to be a new partner with PHEN, and we look forward to this relationship and our continuing efforts to, as everyone has already said, to eradicate this very, very serious health disparity that's impacting the African American community. And I would just like to thank you again for the opportunity to speak. And again, I look forward, as well as our organization, with working with PHEN, and I thank you for this opportunity. Have a good day.
Thank you.